I'm Cindy Barclay, CEO of Quality Dialysis. For the past 18 years, it has been our privilege to provide dialysis services in the comfort of your own home. Did you know that over 26 million adult Americans have chronic kidney disease and millions of others are at risk? High-risk groups include those with diabetes, hypertension, and family history of kidney disease. Under the supervision of your doctor, the dialysis nurse will come to your home 3 times a week to administer your dialysis treatments. In 2011, Quality Dialysis became the first home dialysis company to incorporate technology with the patient's plan of care. This technology is more than just electronic medical records. Treatments are captured in real time from the patient's home, resulting in the ability for clinical staff and your attending physician to monitor the patient's activity before, during, and after each treatment. So don't put off the opportunity to get your life back and actively participate in your plan of care. For the past 18 years, we have provided services to patients diagnosed with end-stage renal disease throughout the state of Texas. We are the first organization to provide hemodialysis and peritoneal dialysis using licensed nurses in the comfort of your own home. That's right, dialysis at home, and your nurse is included. We have assembled a panel of individuals that have either been on dialysis or that are currently undergoing dialysis. And let's take a brief moment to introduce these individuals. Tracy Bagwell, who is a dialysis patient. He's receiving staff-assisted home dialysis by his nurse at home. Her name is Tracy Willett, and Tracy, we're so glad to have you today. To my left, I have Lori Soika. Lori is a peritoneal dialysis patient that's been with Quality Dialysis for how long now, Lori?
About 4 years.
And that's going well for you?
Yes, great.
Okay. And then I also have to my left Miss Edith Parks. Miss Parks has been a caregiver for her husband for how many years now, Mrs. Parks?
Almost 4 years.
And we're going to talk about dialysis and the coping mechanisms that's required. And in addition to that, we have some healthcare providers, Tara Hayes, who's a renal social worker, and Kathy Harrison, who is a renal dietitian. Tracy, let's start with you. How long have you been on dialysis? And can you kind of give us a little information about how this problem occurred?
July will be 2 years, and I had a car wreck about 12 years ago, and a lot of antibiotics damaged my kidneys.
You know, that's really interesting because the primary causes of end-stage renal disease are diabetes and hypertension. One tends to think that, oh, if you get diabetes or hypertension, then that's going to be the cause. But you're telling me that you had a car accident, you ended up in the hospital, and antibiotics killed your kidneys?
That's what they say.
And how have you been coping with that? I know that you have Tracy. Tracy jumping in at any time. I understand that you've been dialyzing Tracy at home.
Yes, ma'am.
And how long have you been doing that?
About 18 months.
And Tracy is a trach patient.
Mm-hmm.
He basically is receiving staff-assisted home dialysis because he's a trach patient. It is my understanding that there are not very many facilities that provide dialysis for patients that are trached and that are on the vent. Are you still using the ventilator, Tracy?
Yes, ma'am, at night when I lay down.
How are you able to communicate so well with the trach in place?
Well, not many people can, to start with. They really surprised I can.
Tracy, tell us as a nurse what has dialysis, how does it feel? I mean, you are a healthcare provider. You're providing dialysis in the comfort of Tracy's home.
Yeah.
And what does that mean to you as a nurse?
Whenever we came to him, and the first time that I saw him, I didn't feel like I didn't feel like he was going to be with us very long, because his situation, and gradually over a period of time, he just got better, and he would start to get up, and eventually he was able to get up, and be able to get to his chair. So, and it was a long battle for him, but it was gratifying to me that we were able to help him.
Lori, let's talk to you a little bit. Now, unlike Tracy, you're receiving peritoneal dialysis.
Correct.
Tell us the difference between peritoneal dialysis and hemodialysis.
Peritoneal dialysis is different in that it gives you a sense of independence and autonomy, and that's one of the reasons I chose it. I've actually been on hemo. I was on hemo 25 years ago. Hemo didn't really agree with me. I think it's more of a small body frame type thing, but PD was perfect for me. I'm able to travel and do many, many things on it. My kidney disease was actually caused from lupus, but what pushed it into that was hypertension. And I initially, it pushed my kidneys to fail. I went on hemo for about 6 months. This was back about 25 years ago. And then I had a transplant for 10 years. When my transplant failed, I chose PD. Luckily, I had a physician at the time that offered PD to me. It was never offered to me before, and it's been life-changing for me. I've been on PD for 15 years. It's been wonderful. And I came to Quality about 4 years ago, and it's been even more wonderful with you guys because you've just really, your staff is awesome. You guys have a wide range of physicians that feed into your unit. I have a wonderful physician, so just the whole collaboration of your team and just being able to have some autonomy in my health decisions too. You guys let me do that, so that's helped a lot as well.
Well, we are certainly happy that we can provide the services that we do. And one of the things that a lot of patients verbalize about dialysis is that there are so many restrictions. Now, you come into our clinic, how often do you see us? Once a month?
Once a month. Come in for labs and clinic. It probably takes anywhere from 30 minutes to an hour.
Yeah, because you're always busy. You're running in, Lord, and you're running out. Oh, hurry up, you know. Do you find home dialysis to be a problem? I mean, peritoneal dialysis specifically?
No, not at all. Matter of fact, right now, and actually I feel like I need to point this out, right now I'm on a temporary stint of doing hemo, and I have to admit that I had dreaded it because I'd been on it 25 years ago. It didn't work well for me. I had to take a little hiatus from PD right now, and actually Quality is doing my hemo, the one-on-one hemo, and I was dreading it. It's been great. I come off the machine feeling great.
I'm glad you said that point, because patients don't realize that you can go from hemo to PD, from PD to hemo.
But yes, being able to switch back and forth, I don't think people realize you can do that.
Hold that thought. Stay tuned. We'll be right back.
When I was diagnosed with kidney failure, I wanted to find a company who would work with me to provide me all of my treatment options. That company was Quality Dialysis. When the time came for my transplant, I was ready. I would tell anyone on dialysis, if you want exceptional care, there's no better place than Quality Dialysis. They were there for me, and I know they'll be there for you.
We're back. We're talking to patients about chronic kidney disease and undergoing dialysis. Now, before we went on break, Lori, you were talking about peritoneal dialysis. While we were on break, Tracy mentioned, what is that PD stuff? You know, it's interesting that patients are not educated and informed about dialysis initially. Tracy, you've been on dialysis for almost 2 years now, and you have no idea about peritoneal dialysis.
No idea.
Okay. Why don't we let Lori continue, since you've been on both, since you've had both modalities, hemo and peritoneal dialysis. Can you tell Tracy the difference?
I sure can. A lot of doctors don't give patients the option to do either one, or do they even educate their patients on either modalities. And I think it's really important to do that because I think the patient should have a choice. When I initially went on dialysis, I was only offered hemo, like I said before, and second time around I was offered PD, and it was a much better choice for me. But basically what it is, as you know, hemo, you have a fistula or a graft, and the blood is run through a machine. You do it 3 times a week, anywhere from 3 to 5 hours. Typically, but with PD, you do it every day. It's a more gentler form of dialysis, and I think it really kind of mimics kidney function.
And there are 2 types. There are 2 types of peritoneal dialysis. You're doing the one with
there's a CAPD, which is the continuous ambulatory.
Where you do it yourself.
Yes, correct. And then there's one where you can do with a cycler, where you can do it overnight, which frees you up even more if that works for you. I'm a light sleeper. So I chose not to do the cycler, but the other works well for me. But what it is that you have an access or catheter placed in the abdominal area, usually below the belly button area.
Correct.
And then you fill, what you do is you fill with fluid. It's usually around 2 liters. It's basically like a dextrose solution. And it's based on a Y set. It looks like an IV bag. You fill the abdominal area with this, which usually takes about anywhere from 10 to 20 minutes, and then you drain. Well, initially you drain, of course. You drain the bag, it fills up 10 to 15 minutes, you clamp off, and then you fill with the new bag. And then it dwells anywhere for 4 to 6 hours, and during that time you're dialyzing.
What's good about it is that it can be just as effective as hemodialysis because it removes the toxins and the extra water that you're building up, you know, when you're unable to do the job.
Correct. I mean, I never usually get a lot of fluid on me. Of course, I do watch my fluids and I watch salt intake, but it gives me
Very
a lot.
important.
Yes, but it's a lot more liberating in that you don't have to, like right now, as I said, I'm on temporary hemo, but I'm really having to watch what I eat. I'm having to watch the potassium, especially over the weekends when you go the extra day, having to watch the phosphorus, take the binders. And of course, you take binders when you're on PD as well, but I haven't had to take as many. The diet just alone, and I mean, let's face it.
We're going to have our dietitian who's going to
yeah.
talk to us in a little bit about that, you know, how liberal the diet
Oh, it is for
peritoneal
PD.
dialysis versus hemodialysis.
Much better
Yes,
because
yes.
you do have to watch what you eat,
Yes.
but it's not as restricting as hemo is. And the scheduling is not, you can play, like I said earlier, you can play with when you do your exchanges as long as you get them in, and it frees up your life.
Well, we'll be right back with Edith Parks, who's going to be talking to us about the challenges associated with being a primary caregiver. Right back.
This is Billy Weedwater. He gets dialysis 3 times a week.
Did you know you have the right to have dialysis in the comfort of your home? Federal guidelines mandate that patients on dialysis be informed of all of their treatment options. So get the facts. Call Quality Dialysis today.
We're talking about end-stage renal disease today and patients undergoing dialysis. Edith Parks is a caregiver, primary caregiver for her husband, who is undergoing staff-assisted home hemodialysis. Edith, let's talk about some of the challenges associated with caring for someone with a chronic illness.
You have to always be on guard. The thing that I find most beneficial is understanding what the numbers mean when the reports come out. And when the numbers are good, I know, and when the numbers are bad, I trace back to what he has either eaten or his medication that he didn't take.
You know, I like the fact that you said the numbers because it shows that you're being educated. Mm-hmm. You're being educated by the social worker, by the dietitian, and all of the staff members at Quality Dialysis. How long has your husband been on dialysis?
Mr. Parks started dialysis in 2004, and in 2008 he had back surgery. I went to the hospital then with him and asked, I said, because of the back surgery, he can't be jostled around. Is there any way that we can have home dialysis? So June 23rd, in 2008, we were introduced to Quality Dialysis, and we have had the same nurse come in. Our nurse is named Bernard, and we are early risers, so we get up at 4 or 4:30, and Bernard is there 5 o'clock sharp, and we do it 3 times a week. And about 9:25, Bernard is disconnecting Hayward. So what happens is, after that, we go out to eat or we go shopping. He has no residual effect. And so far, we've been very pleased with it. If Mr. Parks is not feeling well, all we do is Bernard disconnects him, and if he has to go to the restroom or something, he disconnects him, and Mr. Parks will use the restroom, come back, and he has been very relaxed with it. Before we met you and Quality, Mr. Parks was with another facility. I'll just leave it nameless. If he was not feeling well, he would skip dialysis, which is very detrimental to a renal patient. So he's only been in the hospital 3 times in 4 years, and I did not think even then that he needed to go, but because the staff and our nephrologist was so concerned with him, he did go to the hospital. But they clean his blood very well, he gets up after dialysis. We usually go do things, and I drag him around. I retired 3 years ago, and I usually have an agenda every day, and he always feels great afterwards. So we've been very pleased with Quality, and you and your staff. Whenever I call, they already know who I am, and the response is very quick, very efficient.
Edith, you mentioned that your husband has been on dialysis since 2008.
Yes.
So you have had the opportunity to have the experience of in-center versus home dialysis.
Yes.
Can you tell me the benefits or the advantages or disadvantages of having it at home versus in-center or vice versa?
At home, you have your own germs. You have your own germs.
I like that.
Well, when you go to the centers, you have a chair. It might be a chair that you like to sit in, but even though that is your chair, you might have 6 or 7 patients using that same chair. So I think it's better as far as germs, and as far as the staff, you get used to one person's personality rather than dealing with a lot of different issues.
That one-on-one care really makes a difference. Yes. You know, now I know that Bernard is your nurse, and I know that he is primarily responsible for the staff assisted home dialysis, meaning that that's where the patient actually, the nurse comes to your home. But in addition to that, is Bernard just looking at dialysis, or does he have the opportunity to look at other things that are going on with your husband?
He watches TV, no.
I mean, other physical issues that may be happening with him, you know?
He watches him constantly. When he takes his blood pressure, he looks at the phosphorus, the calcium. He and I discuss the labs when they come in.
Assessment when he comes in.
Yes, every day.
Listen to his lungs.
He listens to his lungs. He takes his blood pressure. He looks at him, asks if he has any wounds or if anything has changed. And Bernard's favorite line is there anything that I should know? So he comes in, and we usually tell him what's going on. If there has been a change with my husband's doctor, what happens is I will type out a short note and tape it to the machine if any of the medications have changed. So Bernard is always aware of what is going on. I have a little diary that I use for my husband, keeping up with his appointments and any changes. So Bernard knows immediately what's going on way before.
So you trust that nurse. So,
Yes.
so you're not there. So what you're saying to me is that from the time Bernard gets there until he leaves, he's responsible and he takes good care of your husband.
Yes.
Now, do you feel any inhibitions about, well, I have to be here, I have to watch him, I have to stay here, I have to, you know? So at that time, does it provide any time for you to get out and go and do a little thing?
I like to shop at Walmart.
Walmart.
So at 6 o'clock, I'm at Walmart while Bernard and Mr. Parks, they are doing dialysis. But usually, I have no reservations about leaving him there. He is part of the family. He knows where everything is. The supplies are always brought on time. Bernard is very, very at ease, and he does a great job.
We'll be right back with Tara Hayes and Kathy Harrison. Take care.
Hi, my name is David Ortiz. I'd like to tell you about the professionalism, concern, and care that Quality Dialysis has provided to me. Quality Dialysis offers a variety of treatment options in the comfort of your own home. I don't live to dialyze, I dialyze to live. No matter where you're in Texas, Quality Dialysis will come to you. When it comes to my health, I trust the first and best, and you should too.
Our topic today is end-stage renal disease in patients undergoing dialysis. Tara Hayes is our renal social worker. And Tara, how long have you been doing this? How long have you been providing care for patients that are diagnosed with end-stage renal disease?
I've been working with dialysis patients for about 10 years now. I started out in center and then found Quality and started working with patients in their homes.
Well, what is your primary role?
Well, with every patient, it's a whole different situation. Each patient is an individual and they have a different set of circumstances, different background, different ability to get disability, Medicare, insurance. It's so different with every patient. So the thing that helps me the most is seeing people as individuals, meeting them where they are, and helping them with their own individual set of problems. Sometimes we're only dealing with financial things. Sometimes we're dealing with family dynamics. Sometimes we're dealing with psychological issues with the patient or the caregiver. Just depends on what's going on with that particular, patient as to what we deal with. But my main thing is to try to work with them where they are and help them navigate whatever systems they need to navigate. This whole big pile of things that come with being sick as a person with chronic illness. Just working with them on the things that we need to do to help them to piece that out and make it through. I mean, the adjustment and, that kind of thing.
We've gotten calls at Quality where patients would ask, well, do I qualify for dialysis? They have no knowledge as far as benefits are concerned. How do I qualify? Well, what's going to happen to me? What can you say to help them to better deal with this financially?
Well, I can, number one, let them know what they're eligible for, what they may be able to get, help them to understand in whatever circumstance they're in, how to maximize whatever benefits they do have. Many times employers don't tell people everything they need to know. They just don't.
And it's becoming more difficult now to get that information from, it's like pulling teeth,
Right.
to get that information from employers.
Right. So one of the roles that I play is helping to enable the patient, making them feel like they can ask the questions that they need to ask. Sometimes they don't know what to ask. That's the way I help them, to know what they need to, how they need to put themselves in a better position, with whatever they need to do to maximize their benefits. One of my first things to tell them is that this is not the end. I can show you what to do to make this thing work. You can do this just like you've done other things. And I try to help them to pull on what they pulled on before. Whenever there was some kind of situation that has happened in their life, pull on that source that you had. You can do it with this too. That's one of the things that I try to help them do.
We're talking about chronic kidney disease in patients undergoing dialysis. Before we went to commercial, we talked to Edith Parks, who went on and on and on about the numbers. Kathy Harrison is a renal dietitian, and we're going to ask her right here and now, Kathy, what does Edith Parks mean when she's talking about those numbers?
Well, I'm so glad she even mentioned numbers, so that means I'm educating well. But those numbers are very important in their overall health. We look at their potassium, we look at their phosphorus, we look at their sodium, we look at their calcium, we look at their PTH, we look at all these numbers.
PTH, what is PTH?
PTH is parathyroid hormone, which
that is indicative of?
It's directly related to the mineral imbalance that they have when you have kidney loss. When your kidneys are not working anymore, the minerals become out of balance. And so when the phosphorus goes up, there's a natural mechanism that the PTH goes up. And when the PTH goes up, calcium comes out of the bones. And so that can do a lot of damage to your bones. It can also be deposited into your cardiovascular system. So I'm constantly reminding patients about it and trying to help them make better choices so that they can enjoy their life and have great food, but kind of direct them, direct them and encourage them on what are better choices for them.
Lori's on peritoneal dialysis, Tracy's on hemodialysis. It seems a little bit unfair, but one has a more liberal diet than the other. Why is that, Kathy?
Well, on the hemodialysis versus the peritoneal dialysis, you can have more protein on that because the exchanges, you have so many exchanges, you're losing more protein. Right.
Whereas that's not true for
and that's good for people that like protein, because some of these people like to eat big steaks and stuff like that, and that's okay. Also, because of the peritoneal dialysis, you're losing protein, you're also losing potassium with these exchanges, and so they get to have a more liberal potassium diet. Also, when you're on peritoneal dialysis, you get to have a little more fluid. On a hemodialysis patients, we usually recommend that they try to limit their fluids to 4 to 6 cups a day.
I noticed that you and Tara really work very closely together. Patient contact, which is very important, and follow-up. How often is that done? Tracy, do you have any? How often do you speak with Tara?
Oh.
How often do you speak with Kathy?
Kathy's at least once a week.
That often?
Oh, yeah.
Are you always excited about her phone calls?
Oh, yeah.
Well, he should be. He has done remarkably well. He's had significant weight loss, a desirable significant weight loss. He is a patient that, you know, calling him, I think, encouraging the hope. And I mean, sometimes I might be bugging you a little bit, but it's, you know, to help you have success and look at the success you've had. I'm just so proud of him.
Well, and I just want to input something here. I think it's important that all the patients, whether you're on hemo or peritoneal, work with your dietitian closely. And one thing Kathy's done is really educate me on how much it affects other organ systems in your body.
Correct, correct.
I mean, just because you have kidney disease, if you don't watch your numbers or your report card, so to speak, it's going to affect every other major organ system in your body.
That is correct.
Immunity, heart, bones. I mean, and I don't think people realize how much the kidneys do. And when they're not working properly, you've got to really be on top of that to have quality of life in other areas, or you're going to watch your other organ systems really begin to deteriorate. So it's very, very important to work with your dietitian, and Kathy's been awesome with that and educating us and really keeping us up to speed on what we have to do. So
that's wonderful, Lori. Tara, let's talk about modalities. A lot of patients are ill-informed about treatment options and what they can do. I personally know of 4 treatment options. Am I wrong?
Well, this is the thing. When patients lose their kidney function, patients always adjust better if they know more. So one of the main things that I try to do is make sure that they know what all is available to them in accordance to what their doctor feels is best, best for them. I'm not going to throw things.
Yes, we don't want to omit the fact that they should consult their health care
I'm not going to throw
physician.
something out unless I know.
Right. We work very closely with doctors to ensure that patients.
So I'm always telling them what's out there, but letting them know, hey, you need to talk with your doctor about this. Say, for instance, if we're talking about transplant. I mean, that's one of the first things I begin talking to patients about. But I tell them, before you begin to even think about pursuing this, talk with your doctor about it to see if it's something that your doctor feels you're ready for, that you can deal with, you know, because that's a big undertaking, going through the transplant workup, doing all the things that they want you to do in order to become a actively listed candidate.
Is transplantation a cure?
Well, transplantation is not a cure for kidney disease. It is a treatment. It is a treatment just like peritoneal dialysis is, just like a hemodialysis is, and then another option is to not have treatment at all. That's one of the options that patients do have, and it's my responsibility to make sure that they know all their options.
Well, we at Quality are so happy to have both of you on our healthcare team. You just do marvelous work on a day-to-day basis. I'd like to thank our participants for being here with us today. Tracy.
Tracy.
Lori. Edith. Kathy, and Tara. We really enjoyed sharing our program with you today. Join us online at qualitydialysis.com. Have a great day.
When I was diagnosed with kidney failure, I wanted to find a company who would work with me to provide me all of my treatment options. That company was Quality Dialysis. When the time came for my transplant, I was ready. I would tell anyone on dialysis, if you want exceptional care, there's no better place than Quality Dialysis. They were there for me, and I know they'll be there for you.
Hey, Dr. V.
Hello, Willie. How are you?
I'm doing great. Who wouldn't be? I'm getting dialysis at home.
Well, that's something I wanted to talk to you about. Your insurance company called today, and you may have to go back to the center.
I have the power to choose where I get my dialysis. Sick 'em.
Oh, down, boy. Oh.
Quality Dialysis. So give us a call. We are here for you.